My name is Xavier Salablanc from Barcelona, Spain, and we spent the last 2 days here in Leuven, in Leuven, working in this nice university, the university where Vesalius do the first dissections, and we evaluate during these 2 days in some cadavers the effect of the pressure inside and outside the roots and the trunks of the brachial plexus. I think it's interesting for the future because the pressure is an important monitoring to avoid complications in probably the next long time for all the anesthesiologists who do blocks, especially in the upper limbs, but perhaps in some other parts of the body. I enjoy so much these 2 days here, and probably come back in the future in a few months again to this nice university.
My name is Jeff Godson, and it's a real pleasure and honor to be here at the Vesalius Anatomy Institute. It's a real honor to be amongst the history of a place like this, and to do investigative work that I think will really mean a lot and had a great deal of significance for us as clinicians. We do know a lot about nerve injury, and we're learning more and more from patients and from clinical studies, but in particular to the relevance of proximity of the needle to the nerve and needle inside the nerve, and concepts like this really need to be done in a setting like this with cadaveric work, and it's been just outstanding, the experience today, working with an international team from all over the world, all of whom bring their areas of expertise to the table to work together. And what we did in 2 days was remarkable. Everybody had a role, everybody did their own part, and we worked like clockwork through a lot of work. So I look forward to seeing the results.
I'm Klaus. I'm one of the residents here in the University of Leuven, and I had a great opportunity to work together with Professor Hetzig on pressure monitoring when injecting local anesthetics with ultrasound guiding. I think it's very important to have done this and to use this technique for later on as a monitoring technique, because there's not much known about it yet. I think it's indeed a very good and important thing that they start doing research to measure what actually the pressure inside the nerves and outside the nerves at the brachial plexus is.
My name is Tim. I'm working for BK Medical in Belgium, and we had the last few days some really exciting days. We have been cooperating with an international team, and which was a part of Catholic University of Leuven from Belgium, and some people from the NYSORA came over. And we have done research for some nerve blocks, and we supported the international team with the ultrasound. And for this case, we really wanted to give him the opportunity to work with a real high-end system, and we supported with the Flex Focus 800. And they needed all day the scanning, and they needed a big file to keep the clips on. And my impression was that they really liked the support and the high resolution, and they were really pleased about it because we have a lot of images in a few days done in 2 days. So it was really exciting to have this team on in Belgium and to work with them.